Now, mastalgia. Mastalgia is a breast pain in women, typically classified as either cyclical or non-cyclical. Cyclical breast pain is benign due to estrogen and progesterone changes associated with the menstrual cycle. The cyclical pain usually begins 2 weeks prior to and subsides with the onset of the mens. The pain is typically described as the heavy bilateral dull pain. Heavy bilateral cyclical breast pain is heavy bilateral dull pain. Typically, no examination abnormality. There is no breast mass, skin changes, axillary lymph node, nothing. In non-cyclical breast pain is constant and is associated with the mens and is not associated with the mens. Cyclical breast pain is associated with mens. Non-cyclical breast pain is not associated with the mens. And is variable. Location involves in a single breast involves the single breast. Patients may have associated with breast mass. Patient with non-cyclic unilateral or focal breast pain and those with abnormal examination findings breast must require further evaluation with breast imaging or biopsy. What you have to do is to use supporting bras which minimizes the breast movement and NSAIDs for breast pain. If you find a patient with a breast discharge, matter nipple discharge, if it is bilateral or unilateral, if it is bilateral, do pregnancy test and galactory evaluation. If it is unilateral, age less than 30, ultrasonogram and mammogram, and age more than 30, ultrasonogram and plus mammogram. That's all about the breast discharge evaluation. Now, evaluation of the nipple discharge, the nipple discharge, color of the discharge, if it is bloody or serous discharge, pathologic disease, breast ultrasound, and mammography if age is more than 30. So 30 is the demarcating point for this type of discharge. And color of the discharge, if it is milky, non-bloody discharge, palpable lump or skin changes present or not. If it is present, pathologic. So do breast ultrasound with or without mammography. Palpable lump or skin changes, there is no palpable lump, no skin changes, likely physiologic. Discharge, pregnancy test, WAC test, serum prolactin TSH, and consider MRI of the pituitary for galactory evolution. So evaluation of the nipple discharge, if it is unilateral, if the evaluation of the if bilateral nipple discharge, then do pregnancy test or galactory evaluation if unilateral pregnancy, unilateral nipple discharge, age less than 30, ultrasonogram with or without mammography, age more than 30, ultrasound with mammography. Evolution of the nipple discharge, unilateral breast, pathologic disease, breast ultrasound, and mammography. Age more than 30, unilateral breast. Color of the discharge, if it is bloody or serous discharge, then you have to do breast ultrasound and the mammography, breast ultrasound and the mammography, breast ultrasound and mammography. If the color of the discharge is milky and non-bloody discharge, palpable lump or skin change is present or not. If present, then pathologic discharge, breast ultrasound with or without mammography. If no palpable skin lump or skin change is not present, likely physiologic discharge like pregnancy test, WAC test, serum prolactin, TSH, and consider MRI of the pituitary. And galactorrhea is defined as a lactation in male or non-breastfeeding woman. It may be a sign of a potentially significant disorder should be evaluated. Physiological galactorrhea is usually bilateral, black negative, and can be milky, most common, yellow, brown, gray, or green. Hyperprolactinemia is a common cause of physiological galactorrhea and can be due due to pituitary prolactinoma medication like antipsychotic, antidepressant, and opioid can cause this type of thing. And stimulating pituitary lactotrope estrogen containing contraceptive, hypothyroidism, pregnancy or chest wall or nipple stimulation, surgery, trauma, shingle. Galactorrhea should be evaluated with pregnancy tests, serum prolactin, TSH, and possible MRI of the brain. Nipple discharge not consistent with lactation. Breast milk secretion is classified mm, as physiologic and pathologic. Physiologic is bilateral, multiductal, milky, non-bloody, and pathologic is unilateral, uniductal, bloody, serous, and spontaneous. Physiologic nipple discharge is typically caused by benign process outside the breast, hyperprolactinemia. In contrast, pathologic nipple discharge typically signals that abnormal process, papilloma carcinoma abscess is present within the breast. A premenopausal woman can have transient idiopathic galactorrhea that is benign and typically self-resolves. The most common cause of pathologic nipple discharge is papillary tumor, intraductal papilloma originating from the breast duct lining. Intraductal papilloma are typically benign and may not be palpable on examination. However, they may have an area of associated atypia, ductal carcinoma in situ, and intraductal carcinoma. Management of the nipple discharge, physical examination, abnormal breast imaging, biopsy, refer to a breast surgeon. If it is normal, if it is physical examination, normal, ultrasound mammography, normal, galactorrhea evaluation, abnormal, percutaneous biopsy, galactorrhea evaluation, normal, routine screening, abnormal, treat as indicated. This is the management of the nipple discharge. So physical examination, normal, physical examination is abnormal, abnormal breast imaging and biopsy referred to a breast surgeon, and physical examination normal, ultrasound and mammography normal, galactorrhea evaluation normal, routine screening and ultrasound and mammography if abnormal, percutaneous biopsy should be done. Age more than 30, usually ultrasound is the done. If age more than 30, both ultrasound and mammography. If age less than 30, only ultrasound is done. Mammography is typically performed first. It has high specificity for identification of the suspected breast tissue. Even if mammography is normal, ultrasound is required because this modality increases the detection of small, non-calcified, and intraductal lesion that can cause these sort of nipple discharge. So palpable breast mass, age less than 30, ultrasound, without the mammogram, more than 30, mammogram should be done. Simple cyst, needle aspiration, if patient desire, needle aspiration. Complex cyst, solid mass, image guided core biopsy, suspicious for malignancy, core biopsy should be done. Age more than 30, mammogram and with or without ultrasound. Suspicious for malignancy, core biopsy should be done. Core biopsy should be done. Core biopsy should be done. uh, that's all about the breast mass. Hope you enjoy.